Hi, I'm Dr. Scott Meyer. I'm the author of Incorporating Progress Monitoring and Outcome Assessment into Counseling and Psychotherapy. And I want to do a brief overview and introduction to the book. I think this is a very exciting time for therapists in that there is now a research literature on using data from change-sensitive tests to provide feedback to clinicians about whether their clients are changing or not. And this is a very difficult question for most therapists, is how do you know if your clients are improving? A lot of the research suggests that clinicians may be not the best judges of that, as evidenced by the fact that a lot of clients, if they drop out, often do so during the first couple sessions. But now there is a research literature based on a lot of research by Michael Lambert and Scott Miller and others that have done a very nice job of laying the foundation for providing a basis for clinical feedback in psychotherapy. And so I think these are exciting times. I think we're going to see a lot more use of progress monitoring and outcome assessment for a number of reasons. In the U.S., Obamacare has been successfully implemented, started. While it's not clear exactly how it's going to shape up over the next couple of years, there's clearly an increased emphasis on accountability. And so I think therapists are going to increasingly be asked to show evidence that their work with clients is effective. In addition, the effectiveness question is going to become more important because there's kind of more and more realization that there's a relatively high treatment failure rate in counseling and psychotherapy. And that partially depends on how you've defined treatment failure, but the two components seem to be clients who do not improve over time and clients who actually deteriorate. And if you combine both of those categories, for a typical therapist, probably 50% or more of their clients either fail to improve or get worse, with fortunately the get worse percentage being 5 to 10% on average. But again, there's clearly a need for some information, some data to help clinicians make more informed decisions about whether their clients are making progress or not and whether they should change or adapt the therapy that they're providing. I call this whole approach feedback-enhanced therapies. I think there's also terms like patient-centered therapy, feedback-informed therapy, but the whole idea is a relatively simple one, and that is, as the client participates in therapy, there is some method for gathering data about whether they are showing change, stability, or worsening on one or more indices thought to reflect psychotherapy progress. And this process of gathering data is becoming more and more feasible and easier for the clinician and client. In particular, the accessibility of electronic medical records, the accessibility of tablets and laptop computers makes it easier for clients to provide data, for clinicians to provide data, and for clinicians to see the results of those data collection and analysis over time. But in general, I think there's a push for accountability, and part of that push is to give clinicians useful information about how to know if their therapy is working with any particular client. Overview of some of the content we're going to discuss today. First ideas I want to bring up are the idea of states versus traits. Traits are assumed to be stable, enduring characteristics that people have. When you think of personality traits like introversion, extroversion, or of a trait like intelligence, we assume these are characteristics that remain relatively stable over time. And the contrast to that are states, which are characteristics that are not stable, that do change in response to situations or in response to interventions. We might think of mood, for example, being something that's relatively unstable, that can change over time. And the contrast I bring up here is that personality tests are generally interested in measuring traits because they're designed to predict more long-term behavior and performance. Similarly, with intelligence tests, they're assumed to be measuring the trait aspects of intelligence, because typically with intelligence type tests, and I include things like the GRE and the SAT with this, we're interested in predicting students' academic performance down the road. So if you took the GRE is designed to help us understand what your performances will be like in graduate school and beyond. In contrast, for progress monitoring for counseling and psychotherapy, we're interested in assessing things that show change. Things like constructs like distress or anxiety or depression. We assume these things can show change in response to psychotherapy, and so we're interested in assessing that with clients to see if they're making progress as intended. Now let's define a few terms a little bit more specifically. Progress monitoring refers to the use of change-sensitive measures to produce data to monitor client progress, and particularly to provide feedback to clinicians about change or the lack thereof. In contrast, outcome assessment refers to more of a pre-post type of approach, where you might give clients a measure at the beginning of therapy and at the end of therapy to see how much, if any, they've changed. So progress monitoring is designed for short-term feedback, outcome assessment for more of an overall summary of did the client improve as a result of counseling and psychotherapy. The problem and the importance of treatment feedback is that many clients fail to improve in counseling and psychotherapy. Even with treatments that have been shown to be effective on average, so-called empirically supported treatments, maybe only 30 to 50% of clients actually show change. So that means about half of all people who enter counseling and receive a empirically supported treatment don't. In some cases, it may mean that they stay the same, or that they sometimes get worse, and the treatment has no impact on them in terms of improvement is the main issue. So the interest in providing feedback as part of therapy has become known as feedback-enhanced therapies or feedback-informed therapies. And these approaches incorporate frequent measurement, again, progress monitoring, designed to help the therapist and the client understand whether or not progress is being made. And the key issue there is, even if you have a treatment that's been shown by research to be effective on average, how long should you continue to use it if it's not helping the client to improve? If the client's not showing change, at what point should you alter your approach and try something different? Now, in any area of test construction, whether it's personality testing or progress monitoring testing, that is, whether traits or states, it's very helpful when you're constructing a test to know as much as possible regarding the theory and research that's been completed in the area that you're interested in. So if we're interested in creating a measure of progress monitoring for counseling and psychotherapy, there are some generalities that, some general conclusions from research that are useful to know. First of all, many clients improve as a result of counseling and psychotherapy. This level of improvement typically exceeds that in a control group. One of the factors associated with this change is the strength of the therapeutic alliance, meaning the bond between clients and counselor. And another interesting part of psychotherapy outcome research is that gains seem to be roughly equal across therapy types. So no individual type of therapy, whether behavior therapy or psychodynamic therapy, appears in general to be more efficacious than others. Finally, poor outcomes are associated with more severe client problems and also with client resistance, meaning clients who come in with more long-standing, more intense psychopathology are going to show less positive change, and clients who show resistance and unwillingness to cooperate in counseling and psychotherapy also tend to have poorer outcomes. So, in terms of progress monitoring measures, that is, measures we're going to use for counseling and psychotherapy, this has some implications. First of all, the measures should be change sensitive. That is, they should be designed to detect states that are expected to change during counseling and psychotherapy. In addition, progress monitoring measures should be brief. That is, expecting clinicians to use them while they have to deal with all their other paperwork as part of their job is unrealistic if the measure is too long. So these measures have to be as brief as possible, completed by the client or the clinician in 5 minutes or less typically. Thirdly, these measures should be derived from an appropriate source. So for example, if you're working with children, asking children to self-report about their anxiety or about their behavior is less likely to be valid data as compared to, for example, a parent or a teacher. And finally, we'd like to have a progress monitoring measure that says something about how you can adjust therapy if things are not going well. The problem with many progress monitoring measures is they give feedback about whether the client's improving or not, but provide no information about what might be causing the lack of improvement and what might be adjusted as part. Okay, let me sum up by talking about a couple other issues. First of all, I do think it's useful to have some training in the use of these tests and the feedback enhanced system. I know Scott Miller's group does a lot of this. There's various ways to get training. If you have questions, you can email me at stmeier, S-T-M-E-I-E-R, at buffalo.edu. I'd be glad to talk with you about training. The feedback enhanced therapy is also, I think, a very good approach for doing supervision. One of the problems with supervision is having enough kind of concrete data to provide students with feedback, and the collection of data by clients or the ratings by clinicians or even ratings by supervisors can help you track whether the therapist is producing beneficial effects. And ultimately, that's one of the ways to evaluate supervision. Is it helping the therapist produce benefits, better outcomes for clients? Should also spend a little time talking about what research is needed in this area. One of the things to pay attention to is the test construction procedures. There's not really a consensus at this point about how to construct tests that are most useful for progress monitoring and outcome assessment. Clearly, such tests need to be brief. In order to be used repeatedly over time. They also clearly need to be change sensitive. That is, there has to be some evidence that the tests that are employed have the capacity to detect the change that clients will exhibit in therapy. And this can be both kind of general effects, such as decreases in negative affects, such as anxiety and depression, or even more specific things. If you have clients that have been referred for anger management, they should show improvement on some measures of anger management. But in general, tests developed for progress monitoring and outcome assessment will provide better data than clinical judgment by itself. There are some other issues. There's some important issues that remain to be resolved by the field. One of the big ones is who pays for this, both in terms of time and money. Unlike physicians who will refer folks for x-rays, for MRIs, at this point the progress monitoring process is just an extra added onto the process of doing therapy and supervision. At some point there should be some reimbursement for folks who go through this progress of feedback enhanced therapy. There's clearly a benefit, there's value added, and so there should be some kind of reimbursement for adding progress monitoring and outcome assessment to therapy. And it may be that the field as a whole needs to add progress monitoring and outcome assessment as a basic standard of care. It's difficult to justify not doing this when the research suggests that adding progress monitoring may help decrease treatment failure rates with most clinicians. So, in summary, that's progress monitoring and outcome assessment. I hope you, if you haven't yet, you strongly look into it, read the book, read other materials, and incorporate feedback in your clinical practice. Thanks for your time.